Everyone, welcome to our Mysticsense series episode. Today with us is Daniel, a mental health professional. Now you may have noticed this episode is a bit different from our previous episodes because we're physically in the same room.
Yes, we are.
Yes. And another thing that's different about this episode is that Daniel is not one of our Mysticsense advisors, unlike our previous podcast guests. So, before we dive into our topic, could you please share a little bit about yourself and your background in mental health care?
So I went to Central Washington Universities when I did my undergrad. I have worked for both the state and private healthcare agencies. I specialize typically with more acute cases, schizophrenia, type 1 bipolar disorder, dementia, Alzheimer's, some more acute cases with severe comorbidities. That's usually where my background is, but also given that I have a soft spot for other particular issues, given veterans with PTSD, given I am a veteran myself who has seen his fair share of ugly, it is something that actually drove me to going into mental health care, is seeing that statistic of 22 veterans per day losing that battle to themselves. So it is a class of people that I try to go out and reach out to.
Yeah, that's quite a few people that struggle with these mental health issues.
Yes.
22 a day is a
per
very
day.
large amount. Thank you for sharing that.
Mm-hmm.
So, I want to talk a bit about why this episode is important to the spiritual industry and the spiritual community. You may seem, some people may be thinking, okay, why are we talking about mental health? You're a psychic platform. You don't do mental health. Daniel doesn't do psychic readings, so why are we even here today? And I have an answer for you on this, why it's so important. So it is very important that we're aware of mental health care and mental health needs. Mental health is very different from the spiritual industry. It is very different from spirituality as a whole, but a lot of people seem to be struggling with mental health issues and seek out psychic or spiritual advice to cope with these things. And that is not always the best course of action. In fact, in many cases, it is not helpful to do that. And as professional psychic advisors, as spiritual practitioners, we ethically cannot talk about mental health issues. We cannot legally talk about medical situations, including mental health. And there's very strict guidelines that we have to follow as professional psychics, as professional spiritual people, to make sure we are not crossing those boundaries into healthcare, because that's not our industry and it's something that we are not trained to help with. So because of that, and because many people on a spiritual journey often have mental health come up as part of that journey, or they're struggling with mental health in the first place and they're seeking out a spiritual solution when they maybe should or could be looking for a more mental health or health-based focused solution instead. Because of that, that is why this episode is so important for our industry specifically, so that you know what the signs are that you might need some mental health care and mental health help instead of or in place of spiritual advice. Does that make sense?
Yeah, and I do want to make sure I preface, since the mental health care is healthcare, advice here, I have to state ahead of time that any advice that I give right now is not intended to treat, diagnose, or cure any disease or ailment, and that if you need any mental health care, that you should actually go out and seek professional care from in the environment that is appropriate. So I cannot, obviously, for legal reasons, answer specific questions that would be intended for actual treating, diagnosing, or curing of any mental illness.
Yes. Thank you for stating that. It's very important. And that also, pretty much what Daniel just summarized, is also in our guidelines, in our terms of service, and in our psychic rules, house rules as well, that we cannot talk about mental health in any capacity, because we are not mental health professionals. We're not acting as mental health professionals on Mysticsense. It's purely entertainment value. So very important to state that. Again, this is public information. This is a public podcast, so please do not think that we are suggesting anything about any specific situations, scenarios, or conditions, because that is not our intent. It's purely for educational purposes only. Did we cover everything?
We did.
Okay.
We did.
Very important. So if you are going to your advisor on Mysticsense and you do get your reading cut short and they say, I'm sorry, I can't answer that, it's mental health, I can't help with that, it's outside my scope, please understand that this episode hopefully will offer a lot of guidance into why your advisor may make that decision. Because there's things we cannot talk about.
That is good ethics.
Yeah. It's very important. It's also the law. So let's jump right in, as we have prefaced why we're doing this episode with a mental health professional, and why it's so important for people out there. It's very important to seek out a licensed mental health professional if you are experiencing some of the things, or you think you are experiencing some of these things that we're going to be talking about today. So our first question for Daniel is, what role does mental health have in creating a balanced lifestyle?
So mental health, as I said, mental health care is health care. So to be healthy is to actually take care of your mental health. Your body is your mind and your mind is your body. The two are intertwined with each other. So if you're not taking care of your mental health, you're not taking also care of your physical health. So it is okay, for instance, to not be okay. It's okay to say that you're not feeling okay. It's okay to set boundaries. But not doing so is not taking care of yourself. So that is why it is so important that you do that. Additionally, when it comes down to creating a balanced lifestyle, it is important to also set time aside for yourself. It is also important to set time aside for you to recover, recuperate, to have that you time. Everyone needs to have that time to center themselves, whether it be through whatever spiritual practice that you decide that you want to participate in, or if it's just an extracurricular activity. You need to be engaging in healthy activities that actually promote good mental health. And this is why it is so important, for instance, to have that you time. So for you, I believe that's tarot card reading, correct?
Yes, that's one aspect of what I do.
Yeah.
I also like to play video games, and
So
that's an activity I find enjoyable. It brings me relaxation, and it's something that I set time aside to do because I enjoy it, and it brings me to a state of peace personally.
Yeah. And you need to have that healthy level of dopamine in your system that helps create those responses of good feelings. And if you are not naturally promoting that, it will. The levels of hopefully I'm not over sciencing this, but the level of serotonin that is created in your body will definitely have some negative impacts. So you really need to have that time set aside for yourself.
Yeah, it's very important. In fact, this setting aside me time is a recurring theme that I discuss on my TikTok channel, not in the sense of mental health, but in the sense of, good activities, balancing yourself, doing things you enjoy. Definitely super vital. But I also want to add that we have another podcast episode coming out in the future that talks specifically about how to balance your spiritual life with your mundane life so that you're not overpowering one or the other. So stay tuned for that in the future. Do you have anything else to add on this topic?
No, I do not actually on that one.
Okay, wonderful. So moving right along then, and sorry we have our script again. This episode is filmed together, so it's a little different from most of our other episodes. So our next question is, what are some signs that someone is struggling with their mental health?
So some signs that someone is struggling with their mental health. You're going to see some reclusion. They're going to be drawing away, loss of interest in their typical hobbies. For instance, a warning sign for you, for instance, if you suddenly said, I'm not really feeling like, I haven't done tarot card stuff in, 3 weeks, 4 weeks, or even more, and, I notice also, like, let's say let's say someone was typically clean shaven. Like typically almost always clean shaven, and they've even said they don't like having facial hair, right? I see that, hey, they haven't been taking care of themselves. They're eating in ways that they normally would not have been eating. Their hair is messier. They say, for instance, I have not gone out a lot, and they're typically more extroverted. Loss of interest is usually one of your classic warning signs when someone is struggling with mental health. Moodiness, someone being hyper defensive, like, no, I'm fine. Things like that. You really want to see someone, if someone is not doing well, you're going to kind of notice that they're not their normal selves, even when they try to mask it. And people do try to put up a wall. The appearance effect that a lot of people try to present is one of, I'm fine, but you can normally tell, especially if you know that person well, is like, no, I could tell you're not fine. And you really want to reach out to that person, be safe, and say, hey, look, have a coffee with me, let's talk. And that way you could get it all out there in the open. And it is okay to encourage someone to seek out more professional care. Honestly, mental health is not, seeking out mental health care is not a sign of weakness. It is a sign of strength. It is a sign of saying, hey, I want to take care of myself. No different than saying, hey, look, I got cancer. Go get yourself taken care of. It's no different. It really isn't. And you got to remove that stigma and saying, hey, I need to go take care of me. What's going on in here? That way, the rest of you could be taken care of.
Yeah. It reminds me, as you were saying that, of a previous episode we had with our psychic Richard, who has done multiple podcasts with us in the past. He has talked often about his personal mental health journey and how it has supported his spiritual well-being as well. And I feel like, just referring back to that is a really good point that we're talking about. That there needs to be that acknowledgement that sometimes we're not okay.
Yeah.
And sometimes you need help, and that's a good thing, because the help is there. You just have to be willing to accept the help or seek out the help. And also, some people notice like their person of interest is acting weird or they're acting off. What are your thoughts about that in regards to mental health?
If they're acting off, there could be either a triggering event, or there could be some sort of underlying modality going on. And you need to also pay attention. I mean, some people will have undiagnosed mental illness, and it's not uncommon for that to happen. And it needs to be adequately addressed, because if it's not, people are suffering. And suffering in silence is what it is. Past trauma, that comes up quite often, is past trauma. And when you don't unload that baggage and actually get that baggage handled, it will just drag you down. And you can't let those kinds of things drag you down, because it'll affect everything else. It will affect you professionally. It will affect you intimately. These are things that will just always hamper you. Until you get those skeletons in the closet cleared out, it'll always be there, just constantly looming. And so that is why it is so important to actually seek out that mental health care. No different than having let's say you have a scar, or like a really nasty cut. You go to the emergency room to get those things taken care of. So if you had like a traumatic injury occur to you, why would you not get that, or traumatic incident? Just like a traumatic injury, if you had a traumatic incident, you need to get that taken care of. EMS, for instance, every time there's a major incident, mass shooting, very violent incident that has occurred, they always make sure those firefighters or police or first responders have some sort of mental health break, and they have a group therapy session, because it is so vital that people decompress. So, yeah, that's why mental health is extremely important. Same with people who are in the military. You see something horrible, they worry about those things, and it's those veterans who don't get that, who don't seek out mental health care, who are the greatest victims of that 22 per day statistic.
Yeah, and you mentioned, police officers, firefighters, things of that nature. Do you have experience with that yourself?
I do.
Would you like to share?
So I've been an EMT. I even had a quick stint of looking into being a cop for a while. And it is, you do only see the worst, of humanity. Whenever someone calls 911, you're not seeing them on their best day. In fact, you're typically seeing them on their worst day, perhaps even the worst day of their life. And so those kinds of things will stick with you. And if you don't take care of those kinds of things, it's like garbage in the dumpster. It'll fester and it'll stink. and the smell will just get worse and worse. And eventually, all you could do is focus on that wretchedness. And until you take out that garbage metaphorically, it'll just sit there and just cause nothing but problems and will eventually consume you.
Wow, what a powerful metaphor for us all. If we're struggling, if you're struggling, before you decide to call a psychic, instead maybe ask yourself, do I need to call a helpline? There are many helplines available, crisis lines available in virtually any country, and there's many online as well.
Yes.
If you do find yourself in crisis, feel free. A lot of them are anonymous. They're free. Make that phone call if you're struggling. And before you think it's spiritual, first ask yourself, is this something more serious? Is this mental health? How is it impacting me? Do I need to talk to someone? The people at the crisis lines, they're I don't want to say they're professionals. I don't know. A lot of them are volunteers, but they are trained specifically to deal with crisis situations. And they have resources that can help you get the help that you need in an anonymous, safe, and free way. Do you have anything to add on that?
Yeah, mental health care is health care. That's really the best way to boil it down. So you're taking care of yourself. And if you feel like you're at your wit's end, reach out. You need to. I mean, don't suffer in silence.
Yeah. Sorry for any interruptions. By the way, we do have a puppy with us. So our next question. So what should you do if you feel like you're struggling? Did we already address that one?
Well, I mean, yeah.
What should we do?
Yeah, you should reach out to a mental health professional. You should, it is okay. Okay, the best one I could even say is if you are feeling like you have reached the point of self-harm, go to the ER. Have them evaluate you. There's typically a social worker or another or what we call a DCR, designated crisis responder, that will be there and will help you. It is an emergency. If you are feeling to the point where you can't do it anymore, it is genuinely an emergency if you feel like self-harm is your option. So that is what you should do. And if you're just feeling like crap, like you don't have that motivation, like the dishes are building up and it's been a week and you just can't do it and you can't find that motivation, your laundry's there, you're out of clothes, and you just feel like the weight of the world is on your shoulders, maybe it might be time to reach out and talk to a therapist. And the thing is, people have this interesting thing of where it is easier to talk to someone who is anonymous versus someone who knows you, because you could unload that baggage way easier on a stranger than it is on, your spouse, your significant other, your parents, because you don't have that, you won't typically feel the same kind of, oh, they know me kind of thing. So it makes it also easier to say, hey, let's reach out to this therapist, because at the end of the day, if you don't like the therapist, you don't have to see them anymore.
Very true. Yeah, no, that's definitely true. It's much easier a lot of times to talk to an anonymous person, especially with the therapist being a professional, a trained professional. I feel like that sets an even stronger boundary that,
yes.
You expect a certain level of professionalism. You expect them to have a certain level of ethics that maybe your best friend might not abide to.
Yeah, there's HIPAA concerns. I mean, they have to abide by HIPAA. They have to abide by all the legal requirements that are involved in that. So they have the legal responsibility to maintain your confidentiality. So if you have something, let's say, that was traumatic that you're not willing to share with someone else, a therapist or a trained mental health professional or a social worker or something like that will be a good person to actually reach out to, where you could talk to them in confidence and be able to actually unload that baggage and know that that person will not disclose this very sensitive thing that you were unwilling to talk to someone else about.
Very true. And legally, they're abided by. They can't. They could lose their license.
Absolutely, they could go to jail.
They could go to jail. Yeah. They could be sued if they were to breach that confidentiality. Yeah. And that in itself adds a certain layer of trust. In my opinion, a layer of trust in that person, because this is their job, that they're not gonna share. They're not gonna tell anyone. They're not gonna share this with anyone. And it can be a really comforting thing, really, to reach out to a therapist. And you don't have to tell anyone that you're going to therapy.
Yep.
You don't have to tell anyone, really, that you're getting mental health help, because it's between you and your therapist.
Absolutely.
So I want to add in that this word HIPAA that we're using, and some other terms that we've mentioned as well, referring to certain laws and regulations, they're specific terms to the USA. But most countries around the world do have very similar laws that are legally binding, and that all professional mental health people that are licensed professional mental health practitioners have to follow by law. And these laws have different names to them. They may have different acronyms, but most countries in the world do have some form of law that protects your privacy, protects your confidentiality, and makes sure that that the information you share or who you're seeing, even as for mental health, cannot be shared with anyone else.
Yep.
Excellent. So our next question then is, what are the differences between a life coach, a psychic, and a counselor, and how are they similar? And before we dive into this question, I want to preface that the term counselor that I'm using in this context is an umbrella term that includes therapist and counselor, and what are some other terms?
Just mental health.
Okay, mental health. So mental health in general. I'm using the term counselor to mean mental health professionals who are often licensed, trained, and employed legally to do mental health care. And the reason why I have to say that is because these words are going to vary depending on your location. Different locations use different words, different titles, job descriptions for the mental health industry, and it also depends on the person's particular role in the mental health. Whether they're a psychotherapist, whether they are a therapist, a counselor, or some other mental health professional. In the context of this discussion, we're referring to mental health overall as an umbrella. I just want to clarify that before we get into the question.
All right.
Yeah, so what are your thoughts about some of the differences? Do you want to start by saying, like, how mental health is different from, say, the spiritual industry or life coaching?
Well, absolutely. I mean, mental health care is healthcare. So, I mean, it's you don't go to clergy if you have, cancer. Just for instance, but if you have some sort of spiritual question, you wouldn't go to a hospital for whatever your spiritual needs were. And so, a life coach, that would be someone who you would just, you would trust. Anyone could be a life coach. I mean, you could be my life coach. Someone you trust, right? And I could come to you advice for, I don't know, let's say investments, or just, hey, what would you do in this situation? Because I'm having this kind of problem. That's a life coach, right? For all intents and purposes, psychic, entertainment value. Maybe it might even provide some insight to whatever you were seeking. Mental health care, well, that's health care. So you're going into, hey, I have a diagnosable, treatable modality of some sort of variety that I need professional care for, whether it be PTSD, whether it be a TBI, traumatic brain injury, PTSD, post-traumatic stress disorder, bipolar 1 or 2 by proxy, something like that, schizophrenia even, say, unfortunately you were diagnosed with that because of you have positive and negative associations or symptoms with schizophrenia. These are serious things that actually need to have professional intervention. So what they have in general in common with each other, I could just say it could help you feel better. But the mechanism of how they help you feel better will really determine on, let's say severity, the type of question, and what you're looking for. I wouldn't go to, I don't go fishing to get myself feeling better if I have, something health going on, some health kind of issue going on. But I would go fishing if I'm a little bit stressed out and I want to go just blow off some steam, right? So those are kinds of, that's my entertainment value. So, no different than if you're going to someone for a psychic, because you want to have, something to entertain you. Tarot card reading, I believe that's what you do, right? You can go there for a little bit of entertainment. Hey, this is kind of fun. Look how novel this is. This is entertaining. I'm getting that shot of dopamine to my system. I'm laughing. I'm smiling. I'm going, ooh, that's interesting, right? So that's that psychic part right there. My brother, who is the CFO of Community West Financial, if I had a question about investments or mortgages or other kinds of securities, that's a life coach. I'm going to go to him and be like, hey, David, what's going on with this? I saw Jerome Powell was loosening up interest rates right there on the Fed. How should I go invest into my 401k? That's a life coach. Because that's going to affect the rest of my life, right? In theory. But that's not me asking for, unless I'm going to like a certified investment advisor and he's actually telling me, hey, go invest in
right. That's important to distinguish.
Yeah,
because I was gonna say that. I didn't want to interrupt, but we do have to be careful with the financial too, because specific financial advice, like tax advice.
Oh yes,
you have to be licensed.
Yes,
you have to be a trained licensed professional.
Exactly.
And I wanted to put that in there because yes, a life coach can say, oh, I would do this if I was in your shoes. I would do this. But if they're telling you, oh, your taxes, I would do this about your taxes.
Yes.
You do have to make sure, as Mysticsense psychics, we do not provide specific financial advice of any kind. We do have career advisors who can, advise you on the direction that you may want to consider. However, we cannot give any form of tax advice. We cannot give specific financial advice. Nothing investment specific that you'd have to have a license, because that is that's another industry that is regulated, that is licensed, that we are not a part of.
Nope. So I am not a certified financial advisor. Mine is mental health.
Right. So you just mentioned that, and I'm glad you did, because that's very important. We don't want to be stepping on their toes either.
Yeah,
we can't. So what do you have to say about that as well?
So that's why I make that distinction. It's like, hey, just like, when you bring up another subject that someone says, hey, wait a minute, that's money.
Yeah.
Money, healthcare, those are kinds of things like, hey, you need a professional involved. So when you say life coach, right, that's, oh, hey, if I were in your shoes, as you said, but if someone's saying, hey, you should take this amount of money and invest in this specific thing, now you're going down a different path. That is no longer a life coach. That is something where a certified financial advisor would take you there. No different than if I said, hey, I'm looking at you and I'm thinking you exhibit all the signs and symptoms of this specific ailment and you should do this specific thing. That is mental health care. That is not life coach.
That's diagnosing.
That is diagnosing and even coming up with a treatment plan.
Yeah, so that's something, definitely. And we're going to get into the red flags to look for a little bit later, what to watch out for, that you're dealing with someone who's not acting ethical. But that is a good example, that if they say, wow, I think you have this condition because you're doing this, this, and that, and, maybe you should do this, that, or this, big red flag, because that is diagnosing. It's a treatment plan. That you definitely have to be a licensed professional to do that in a professional setting as well. Just because your friend is a licensed therapist doesn't mean that it's ethical for them to tell you that in your living room. Outside of the context.
That's actually breaking HIPAA. In fact.
Right, well, that's the thing. Outside of the context of a session, just because they happen to be in this profession doesn't mean they can give that advice if you're not their clients. So definitely a lot to think about with this, that there's these lines, there's definitely strong boundaries that, yes, a friend can say, you know what, I think, if it was me, I would do this with my life. Or actually, if it is a good friend, they would tell you to seek out the advice of a professional if you need it.
Absolutely.
I've done that myself. I've told friends, I think you need to talk to a licensed therapist.
Yeah, and just, like, for instance, conflict of interest. In a hypothetical world, if you came to me and said, hey, Dan, I'm having this specific issue, and I'm thinking about this specific thing, out of ethics reasons, I would tell you, I can't help you with that because I know you as a friend. I cannot help you in that professional setting. Therefore, I would have to refer you to a different professional because I could not, legally and ethically help you, given that I know who you are, and I know you as a friend.
Right. That's a good thing to look at too. And again, we will be talking about the red flags a little bit later on in this discussion, but that is perfect that we do have standards of ethics. I touched on a little bit earlier that one of the reasons you would seek out a licensed mental health professional is because they are legally bound to specific ethics, to specific codes of ethics by law. And one of those, again, is, privacy, but also, conflicts of interest.
Mm-hmm.
It's a very serious thing. So it is important when you are seeking mental health care to go to a professional, but also go to a professional that is neutral.
You want to go to a professional in a professional setting.
Okay.
So you're going to go to the clinic. You're going to go to their office. You're going to go to where they are actually giving treatment. You're not going to go to the restaurant. You're not, or at least the very least, the confidentiality of a phone call.
So a phone call is okay, or is that okay?
It is if it's on like a therapeutic line, on
Okay.
what we would call a secure line. So those are important distinctions. Most countries, as far as I know, use a secure line for HIPAA concerns. That way, confidentiality can be maintained.
Good to know. I didn't know that. And just for a little bit of context, I have been through professional therapy for many years. Currently not in therapy, but I had gone through therapy for many, many years since I was a young teenager. And it really does help. Mental health care definitely changed a lot. I am diagnosed with PTSD from early teens, maybe even before. But it has helped so much having that licensed professional to give professional advice and guidance in my own life. And I know it's helped others too. And I want to add one thing on this question. The differences between a life coach, psychic, and a therapist, counselor, mental health professional is that sometimes, not always, but sometimes mental health does require medication.
Yes.
Because it is healthcare.
Yes.
It can be a physical problem that you're having in your brain.
Mm-hmm.
And I'm not trying to really go into that much. You are. But I'm not. You are.
It would be something simple as like, okay, if you got bipolar 1 or 2 disorder, sometimes they would put you on bupropion or lithium. And, if you put them on lithium, you're going to have to also check blood for your thyroid. You go down a real rabbit hole here.
Okay, so anyway, and I want to just say, because you mentioned some medication names, this is hypothetical. It does not apply to everybody. Yeah. It does not apply to you at all, even if you have this condition. It does not apply to you because this is general. I can't. General, educational only information. So just to put that out there, I don't want anyone watching this saying, "I have that. I'm going to go take it." No, don't do that.
Never ever self-diagnose. Ever. A doctor cannot self-diagnose on themselves. I cannot self-diagnose on myself. You always need to have a disinterested third party involved.
And that's a big one, because I know some people personally who self-diagnose themselves.
The most common one I see is people, I have ADHD. It's like,
and I've seen it cause problems in people's lives for them on every level, because the diagnosis was not professional. It wasn't a trained, licensed professional who was, no conflict of interest that said this. It was just them thinking they had this. That if you suspect that you have a condition, please seek out a licensed mental health professional, because they're trained to know. They're trained to know and identify exactly what is and what is not.
And in the Diagnostics and Statistics Manual, what we would call the DSM-5, there are also very specific narrowed criteria that we use to diagnose, treat, and do a treatment plan for any mental illness. And a psychiatrist, for instance, another type of practitioner would be prescribing medications, because medications are a pretty big deal. This is a big rabbit hole that we don't have time. Yeah, we don't.
And we really shouldn't, because it's none of our business.
Yeah, but on top of that, though, when it comes down to these kinds of things, to say, "Oh, I have this," and you don't know, and you haven't been diagnosed, that could also detract from people who genuinely do. I made brief mention of it. People a lot of times say, "Oh, I'm ADD." Those people who genuinely do suffer from diagnosed ADHD, ADD, it is a real struggle for them. And saying it colloquially, in a joking manner or in a non-serious manner, especially if you've not been diagnosed with it, really detracts from the struggles those people who have those mental,
The conditions.
yeah, those conditions.
I think conditions is a good way to say
Yeah,
it.
and it really it trivializes it,
Mm-hmm.
and just like if you said it in the same way, like, oh, I have PTSD too, but it's like, but were you diagnosed? I mean,
Right.
it's okay, to go out and treat it for it, because I mean, it's not going to say that you don't have it, but it could, if you're just saying it just to be, tongue in cheek, or just, let's say you've had some bad times, but you don't fit all the criteria just because of. It's muddy waters.
Yeah,
it
I
really
have something
is.
to add on that with PTSD.
Yeah.
Because like I have had PTSD from a pretty young age. I experienced domestic violence as a child for a long time, and I had a service dog for a long time throughout high school and college, and seeing people, take their pets out in public, say, "This is my service dog because I have PTSD." No diagnosis, no doctor's note. Nothing professional. They just read on Google that they had these symptoms, and they said, "Oh, I have really bad anxiety. I must have PTSD." That is very dangerous for
Yes.
me as a diagnosed person from a mental health professional who almost needed to be medicated. I did try medication at one point. It didn't work out for me, but it was so severe that I was on medication for a short time. But the fact that I literally could not go through my whole school day without potentially having a massive breakdown and panic attack, and I did sometimes, and I had to have my dog there to alert me. Having someone who just read on Google that these symptoms, and they said, must have this, I'm bringing my dog who's not trained to come. That is harmful to me as a diagnosed person with the condition. Even though I now have been through years of therapy, almost a decade of therapy, I want to say, close to, not quite a decade of therapy, but anyway, having gone through all of that work and all of that mental health, weekly therapy visits to get where I am now, it is really harmful to see people undermining the condition I'm diagnosed with because they feel stressed out or they didn't get the mental help that they needed. Do you have anything to say on that? Because you also had a service dog, right?
Yeah, and unfortunately she passed away not that long ago, and we'll see if I can't get this new pup that you heard squealing in the background. We'll see if we can get her trained up by the VA. But I have military diagnosed PTSD. I in fact, a very good friend of mine, I witnessed die in front of me in a very traumatic way while in the line of duty. And it was something that the VA was terrified for me about. They were even when I was still active duty, they had me going through a lot of therapy because of some of the violent stuff that I saw, and I had a lot of therapy, and it is something that also taught me it is okay to seek that help, but as you were saying, I have this, and not have that actual formal treatment does detract. And it also creates some negative stereotypes and negative tropes, with that detraction, because it trivializes. Mm-hmm. It shows that, your struggle may not have been so bad. It's like, but you have not been in my shoes.
Right, exactly. I'm sorry you went through that. I just want to say, compassion is always helpful.
Yes.
Whenever you can be compassionate to anyone. But, yeah, very, very true is, it does definitely trivialize. Someone that's not diagnosed with it, okay, they may have it. They may. But that's why the mental health is so important. But they may not have it. And
you may have cancer.
Right. And how do you know?
But how do you know? There's one way to find out.
How do you know? And I don't know. I keep mentioning the service dog thing because I've seen. I went through a lot of struggles, and you have too with your housing situation. I know in the past, and it hurts to see that people are denying really needed medical help intervention because of the few that are self-diagnosing and that are making these claims.
Or taking advantage of it.
Right, and these few people that are doing this, they may need help, but a lot of times they don't.
Or at least not in the capacity that they're claiming.
Right. Oh, I mean, and we don't know. And we're not saying that you don't have whatever because we don't know. We're not acting in the capacity.
You need to go in and have yourself taken care of. It's those people who take advantage of or lie or just use it to just not have to pay the pet deposit.
Right. I mean, you can have an emotional support dog. I
That's
think
fine.
most doctors will say, "Oh, emotional
Yeah,
support, great."
But at least you went out to get that care.
Yeah.
And you made the effort, and you showed that, hey, this was a legitimate need versus, I just don't want to have to pay for that monthly pet rent.
Right. And I think emotional support is a lot different than a service animal.
Yes.
And that's another thing is if you don't want to pay your pet deposit, you have depression, let's say, you have anxiety, whatever it is. I'm not saying you do. You know, seek out mental health professional. This is purely educational only. But if you suspect this, please go see someone. Tell your doctor, your medical doctor, tell your therapist, I feel this way, I want this emotional support animal. In the USA, I believe you do not have to pay a pet deposit to have an emotional support.
No, it's illegal to do that.
Right. It's illegal countrywide. You don't have to claim it as a service animal.
In the United States, it is protected under the Americans with Disabilities Act.
Yeah.
And there, unfortunately, is occasional discrimination. I've faced it with my last service dog. I had some landlords try to pull a few fast ones, but and it was entertaining to watch the VA, a federal agency, bringing down the hammer on this former landlord of mine. Needless to say, though, that landlord just decided they didn't want to renew my contract anymore, which that wasn't breaking the law. But they didn't like the fact that I had a service animal.
But they paid for it too, right?
Was that?
They paid for it in the end.
Oh, they did. Oh,
they
yeah.
And justice is sweet. Justice is sweet, right?
Justice was served.
Exactly.
On a hot steaming platter.
And I had issues in high school with my service dog, but luckily I was able to prove everything with my documents because I did go to the mental health professional, because I had the diagnosis and the paperwork to prove it. They just saw that and they shut it down. They said, no, fine. You can have your dog, fine. We're not going to ask any questions.
Yep.
But that's the thing is, it's important, if you are struggling, to get that help, to get that diagnosis, to get that professional opinion, that professional insight, that professional treatment, because it may be more serious than what you think it is.
It
or
could be, yeah.
It may not be.
You know, it's one of those kinds of things. Is once you start digging, you'll find out. I mean, about myself, I had, and I still, I still remember the expletive. I won't say it. That because I don't know how censored you have to.
Right. We want to be rated PG.
Okay. So, but they said you're repressing the expletive out of this, and I didn't realize how much I had been repressing some of the horrible things that I had saw while I was in the military. But I was avoiding sleep. Mm-hmm. I was effectively finding every excuse not to sleep, so I wouldn't have the night terrors. So I wouldn't relive some of those events in my sleep. And, I did everything I could to avoid it. And it wasn't until I started unpacking it and actually confronting it front on. And it was painful. It was very painful to have to, talk about these things that I had repressed. But I also didn't know the depths of how much. And I started remembering details that I had long since packed away. And that was the thing. It wasn't until I actually started getting that therapy did some of my problems start. Now I can sleep through the night, I do take medication for the night terrors, but now I can at least get a good night of sleep. Mm-hmm. And you know what? 8 years ago, I did not have that. I did not have a good night's sleep. I'd sleep for 3 or 4 hours, and I'd do everything I could to not sleep if I had to, just so I didn't have to possibly risk reliving those events.
I'm glad you got the help you needed.
Yeah.
And it's improved your life, correct?
It was the motivation that got me into my profession.
Very inspirational. It's life-changing work, to get the help you need. And who knows where it's going to take you.
Right.
Yeah. You may heal yourself and others.
Yeah.
But you need the help of a professional to do that.
I would not have been able to do it if I didn't have the professional support that I truly needed.
Yes. Very true. I want to touch a little bit on, we talked about the differences. Let's talk about the similarities. Because I feel like we really, really went off on that question. We had a whole conversation about that question.
So easy.
I know, that was like, we were like going through it and it's like, oh, that question is like my favorite question.
Right.
So we talked about the differences. You know, I want to mention, we did briefly touch that medication is sometimes used in professional licensed mental health settings. That is not the case ever with life coaching or psychic or spiritual advice, ever. Psychics, life coaches, spiritual advisors, even clergy people cannot deal with medications or diagnose or prescribe anything.
Treat.
No, treat. Yeah. There's a list of words we have in our country that we're not allowed to say. By law, we cannot say them. So we as psychics, or if you're going to a clergy person or a life coach or even a financial advisor or anyone who is not a mental health professional or a medical professional, licensed medical professional, they cannot diagnose, treat, cure, prescribe, or any of that. They cannot do that legally. If they try to, huge red flag. No matter who they are. Yeah,
at least in the United States it is.
It is. It's the law, and many other countries as well. Not every country, because every country is different. We don't know all the laws in the world. But many countries have laws prohibiting people from doing these things. I know the UK and most of Europe does, and a lot of other places as well. So that's a huge difference. I feel like that's probably one of the biggest differences.
Yes.
I mean, there are many huge differences, but one of the biggest ones is we do not ever diagnose, prescribe, cure, nothing of that sort, ever. Whereas mental health professionals that are licensed could do those things. Some similarities. I want to touch on a little bit of similarities. This is not a list of don't. We want similarities as well. So there are a few things that are similar, and this is where things get a little murky for us as spiritual advisors on Mysticsense. Sometimes we have to tell clients, I'm sorry, I can't answer that. You know, it's beyond what I'm capable of saying. You know, and that's again that mental health boundary. Some things we can't say, some things we can't share. Sometimes we just have to tell you, please contact a licensed professional, whether financial or mental health or physical health. We cannot read at all on any physical conditions, period, including pregnancy because of laws. Again, very similar. Again, mental health is healthcare, so we can't touch those topics. So don't be offended if your psychic tells you that I can't answer that question. You're going to have to see a professional, get professional advice, a professional opinion. That's a good thing. That's your psychic telling you that, one, they're ethical, and two, that they really care about your mental health and your well-being.
I also can't give you any psychic readings.
Right.
For ethical reasons.
Maybe one day I'll teach you tarot and you'll learn how to read the cards.
But I can't do that in a professional setting, see?
Not yet.
I don't lose my license.
I don't know. I mean, reading tarot for fun shouldn't be.
Oh no, I'm talking about in a clinical setting.
Oh no. Okay.
See,
okay.
that's what I was.
I was not getting it.
Yeah. See,
I was thinking, you could sign up for Mysticsense one day.
That's what I do in my spare time is entirely up to me.
Yeah.
But I couldn't sit you down as a client and hey, would you like a psychic reading?
No.
Yeah, no. I'm pretty sure that would
I'm sure
very much get me in a lot of trouble.
It's not up to the rules of your license. Because they like I said earlier, the reason...
It's evidence-based.
Right. The reason people are licensed, by law licensed, is because, again, they have specific guidelines. Sorry, my brain.
No, you're fine.
They have specific guidelines, specific rules, and specific procedures that they have to follow when they're doing these things. For example, a clinical setting with a paid client of yours for mental health.
Narrow criteria using typically the diagnosed definitions within the Diagnosis and Statistics Manual, number 5, DSM-5.
Right. This is not my field. But no, exactly. So if Dan was going to, have a session with a client, Dan would have to follow all of those procedures in that book, specifically to the letter.
And it even gets even more deeper. They go state by state. I have to use what's called the WAC.
I'm familiar with the WAC a little bit.
Yeah, so I have to...
Because I live in the state too.
Yeah, so I have to go by all those kinds of things. So there's criteria here that's localized, to the state. And so I have to go by some of those criteria as well. And there's also other things like insurance and other fun things, and also there's other types of mandatory reporting. I mean, we're going into the weeds here, but things that you wouldn't even, as a psychic, wouldn't even have to even consider.
Yeah, or a client.
Yeah.
Because and that's the thing, everyone. Like, this is why you go to a licensed professional. Because your friend, no matter how good they are at giving life advice, or no matter how good of a life coach they are, they do not know all of these criteria. They're not trained to know these criteria. They didn't go to school for the criteria. If they did,
so much school.
they could get their license, but, and it's very important to go to the licensed professional if you're even in doubt about it. And if cost is an issue, there are programs to help, I believe.
Yes, there are programs. Yes, there are a lot of programs.
There's lots of ways around that.
A lot of low-income programs. I cannot speak to other places, but I know in Washington State, I cannot speak for specifics because of ethics reasons, but there are a lot of programs. Reach out to a social worker or a case manager. You can go to your local DSHS office, and they can definitely assist you with those kinds of what you may or may not qualify for.
Yeah, especially if you're in the USA. But if you're outside of the USA, health insurance, health programs, the healthcare system often does cover mental health care as well. Because you keep saying repeatedly, mental health is healthcare.
Yes.
Let's say it together.
Mental
health is healthcare. Yay! So so your insurance, your state health, your country health, whatever healthcare that you go to a doctor. In fact, if you don't know how to get help, go to your primary care doctor. I've done that myself. I've went to my primary care doctor and I've said, hey, I'm struggling with this problem. Can you refer me to a mental health professional?
Yeah.
And they will.
And that's quite common, actually.
They have to,
yeah. Doctor's referral is actually one of the common ways that we would receive somebody, either voluntarily or involuntarily. I typically get the involuntaries, but that's more my area of specialty. So here's the other thing: mental health professionals specialize. So my background is not going to. So I wouldn't be specialized with your if you had a need and we didn't know each other, your background would not be what I would do. It's just no different than you don't go to a podiatrist to go get your ENT needs taken care of.
Is that the foot doctor?
Yeah, podiatrist, ENT. Ear, nose, and throat.
Oh, I thought you meant emergency.
Yeah, no, I ENT.
Oh, it's so
Yeah,
confusing.
so right?
All the terms.
Yeah, sorry.
That's the thing
Sorry about that.
I actually got my phlebotomy license, so I should know some of these terms.
It's okay.
But
yeah, so you wouldn't be going to your podiatrist to get your ENT needs, or you wouldn't be going to an endocrinologist to get your pulmonary needs taken care of. These are all things that you'd see a specialist. So, my background is going to be different than another person's background. And that is why it's healthcare.
Yeah.
Again.
Yeah, and it's not hard to get. You just tell your doctor at your next appointment, hey, I'm struggling with this thing.
Yes.
Who can help me? That's all you have to say. And they will get you to the right person that is specialized for that issue, who is a licensed professional mental health care person.
It means you're getting the help you truly need.
Yes.
And it is okay to get help. Because you're taking care of yourself.
Yes. So that was we went off again.
Hey, it's fine.
Yes, this is great. But I hope you're all learning something very valuable today. So how are they similar? So this is an area I'm going to talk a bit about because you previously said you weren't really sure about. Dan is pretty new to the spiritual industry. So, right?
Yeah, I mean, I take no sides. Yeah.
Yes, which is great that Dan is here with us today because they're very open-minded about things. So that is wonderful. It's great to have people from the medical industry and the mental health industry coming in and sharing, this cross-industry discussions together. It's great.
Good bedside manner.
And it's nice that we have, diverse voices that, just because you're spiritual or, it's very different. A lot of people think, okay, psychics and medical is not mixed, and they don't. They're very different. But we can get along.
Yeah,
right?
Absolutely.
And we can mutually benefit each other by working together.
So it's not uncommon to have a priest come into a hospital,
right.
at a patient's request.
No
that's
different the important part, though, the patient's request.
Yeah, and if I had a session where I had a patient request their spiritual or whatever advisor to be there. Obviously, there would be some legal things that I would have to, get involved, but it is not entirely unheard of to have that kind of thing happen.
I actually wanted to do that because I'm an ordained minister and I wanted to go to hospitals and do that. But then I was like, I don't want to do the paperwork.
There is paperwork involved.
I could.
Quite a lot.
I probably could do it, but I don't want to do the paperwork.
There's a lot of HIPAA paperwork.
Yeah.
But Health Insurance Privacy Protection Act.
Yeah, but I mean, that's the thing is, we can be friends, we can mutually benefit each other, but we're not the same.
Mm-hmm.
And that's very important. And we've already really discussed that thoroughly. I think we drove that point home.
Yeah, and working in mental health is about a matter of respecting others. And
yes.
Respecting their opinions, beliefs, and everything, and respecting that everyone's going to have their opinions and not looking down on them for it.
So how are they similar? This is where things get a little interesting. Again, we can't provide any sort of mental health or medical health or legal, financial, but the similarities could be that your life coach listens to what's happening in your life. Your psychic listens to you, your situation that you're dealing with. They listen. They may provide their opinion on what they think about the situation. Life coach, same thing. They may provide an opinion about what they think about the situation. The therapist also listens to you. Counselors listen to you. They listen to what happened to you. They may provide their viewpoint if they depend. I mean, I don't know. My therapy.
I would say this: all three hopefully make you feel better
yes.
at the end of the day, in whichever way that was that you were looking for.
Mm-hmm.
That's what I would hope.
Yes. Yeah, and it's good to be listened to have someone understand what you're experiencing. Whether they can do something about it or not depends on the industry, depends on the situation, depends on a lot of different factors. But these three industries, these three people would listen to what you're dealing with, may provide their personal opinion. Now, an opinion is very different from a diagnosis. It's very different from a treatment. It's not the same. Stating my opinion is, I like cake. Now, Daniel may be allergic to cake. If I was saying Daniel needs to eat cake, that would be crossing the line. I'd be prescribing a course of action. We don't do that. That's big red flag, right?
Very.
Now, I may love cake. Daniel may hate cake. Daniel may be allergic to cake. Me saying I personally love cake is fine. But the moment I tell someone else what they should not do, what they should not think, that is where I cross the line. So all three of these people may provide an opinion. Oh, I love cake. Okay. That is one similarity. Now, what they do beyond that is very different. That's separate, right? Do you think that's a good example?
Yeah, I mean, if I prescribe you 6 sessions of cake, and preferably twice a day.
Oh, that's not good for me.
No,
my doctor would say no. Doctor says no cake.
I say anyone who doesn't like cake, there's something very wrong with them.
You know you like cake. I just said you hate cake.
Oh, yeah,
you see, I'm projecting.
That's right. I hate cake.
Okay, you see, I'm projecting onto Dan. That's a red flag right there. Okay.
Look at that.
So, stating my opinion, I love cake.
And now I'm thinking I like cake.
Yeah.
I thought I hated cake.
But you see what I'm saying here is there's very, very differences. Listening's a good thing. Being supportive, being empathetic. Wow, I'm sorry you're going through that. That's something all three of these people can do. Provide a sense of empathy and, support. Say, wow, I'm sorry you're dealing with that.
Yeah, have some positive regard.
Yeah, I hope things improve for you. That's great. Now, how they want it to improve, that's a different thing. You need licensed help to do that. But saying, wow, I'm sorry you're struggling through this. I hope things improve for you. Thanks for sharing that. That is another example of how these could be similar. That sense of understanding, that sense of support. Empathy is another thing all of these different professionals have in common. There are many differences, but at the end of the day, we do hope that people feel better.
Absolutely.
Whether we can do something about it or not is, different. Depends on your license and what industry you're in. But we sincerely hope that you improve and you feel better, and we can offer support. We can offer, empathy, a listening ear. That's really what I have to say about that. I mean, aside from that, life coach, psychic, and a mental health professional are very different things. It's important not to confuse them. Do you have anything else to add on how they're similar?
No, I do not.
Okay, you think that was well explained?
I do believe that was well explained.
Thank you. Yeah, so that was my take. So I feel like that question kind of is the bulk of our topic today.
Right.
We have like a bunch more questions. Okay, so sorry about that. Can you tell what type of professional you should contact? So if the viewers are struggling with something and they're like, oh my god, like I don't even know who to contact with this, how can you tell which type of professional you should reach out to?
If it's bleeding, go to the ER. If you're going to make it go bleeding, also go to the ER. The reality is, you don't self-diagnose. Go to where you know there's help. If it's an emergency, you go to where an emergency is. If you feel that you're just struggling, go to a healthcare center or a mental health care center, or as you pointed out, go to your primary care provider and seek a referral. Let those healthcare professionals whose literal job it is to help you, whose literal job it is to actually point you down the correct path. Anytime you try to do a self-diagnosis or you try to steer the ship on your own accord when it comes down to your own healthcare needs, you risk not getting adequate treatment. And that's why it is so important that you actually go in and look for those referrals. So that's my advice on that.
Yeah, that's very true. Is the risking inadequate treatment is a big thing, because we don't always know what we need.
Yeah, you don't know what you don't know.
Right. So I personally feel on this, which type of professional should you contact? Assess the situation. Ask yourself, okay, what is the source of this? Is it a situation that's bothering me, or is it that I'm just really feeling this thing that I just feel overwhelmed or whatever? If you can't pinpoint the source, definitely seek out professional mental health person.
I mean, if you're in, look at it in this way: is it an emergency or is it just eating at you?
Yeah.
If it's an emergency, go to the ER or emergency room. Sorry, I say ER, but emergency room.
Yeah. Or
urgent care, and get yourself, referred, because especially if you're in crisis. If you are just so overwhelmed that you cannot do it anymore, there are people there whose literal sole job is to help people in genuine, true crisis. They're called a designated crisis responder, and they could help you through that. And if you have to get yourself, in a psychiatric treatment for a little while, that is not the end of the world, because at least you are taking care of an emergent need. Having yourself go to a mental hospital for however long you need is treating an acute condition. If you're feeling suicidal, like you're going to go self-harm, that's a genuine emergency, and you need to have that taken care of. If those thoughts, those dark thoughts, are going through your head so much that you're thinking about, doing something dramatic or drastic, that is an emergency. And so that's where you should go in and actually have yourself treated at an emergency room or an emergent care facility. If it's just coming to the point where you realize you're not taking good care of yourself, you're not sleeping well, you're not eating well, your day-to-day life is being interrupted from either intrusive thoughts or negative behaviors or things that are just not going well. Obviously, this is not a true emergency, but it is a chronic condition. So that's why you're going to go in and get that taken care of. And so you would go and see a therapist or something like that and get yourself referred.
Yes. So that, of course, if you do feel like it's overwhelming, like Dan said, definitely seek out immediate mental health help, whether that's through the medical or through a mental health facility. Now, if you are just if it's a situation just kind of bothering you, let's say your friend offended you and you're just like, oh, I'm just really mad at my friend, but you're kind of okay, and it's not really eating at you, you're kind of okay, you're just a little frustrated about the situation, you may want to talk to like a life coach or a relationship person to say, okay, I just want to clear the air, get it out, and I'll feel better. For some, some general, just a listening ear. If you are feeling like you're just really curious about something, and it's not emotionally bothering you're emotionally fine. You're just really curious, like you just really, really can't wait to see what he's gonna say, next week, or is he gonna ask you to the dance or something. You may want to get a psychic reading. Now we cannot guarantee results, of course, but if you're just really curious, you're really excited, or even you're just really nervous, how's that job interview gonna go? I'm really nervous, I just really need to know how it's gonna go. That could be something a psychic reading may help you with, because it can give you that insight. It can give you that thing to look forward to. Again, it's not guaranteed, but it can at least be an entertainment value. It can be something to think about, something to put through your mind. If you're feeling like you're not really sure what direction you want to head in next, though you're emotionally fine, you're feeling okay, you're feeling confident, you're feeling grounded, but you're just not sure what you want to do next in life. You may want to seek out a life coach. You may want to get a psychic reading on your life path. But it's important, if you're emotionally struggling in any way, shape, or form, and it's overwhelming you, definitely seek out that mental health professional. That's what I have to say on the differences. Do you have anything to add on that?
Oh, I actually do. That's pretty well spoken.
Okay, thank you. Yeah, so, and the thing about psychic readings, and I'm going to have this in my next upcoming video as well, about balancing the spiritual and mundane, which is coming in the future. The thing about it too is you want to notice if you're obsessing or becoming addicted to them. Because I actually personally have a client who gets regular psychic readings from me, and I have kind of backed away a little bit, even though she pays me for the readings. She said, I need an emergency reading. That's what she said. And when she said that, it really bothered me, because my ethics are that I do this to provide spiritual guidance. I do this to provide spiritual support. I am not a mental health person. I'm not a mental health professional, and I am not equipped to deal with emergency situations. And if you really feel like you need a psychic reading, not want, there's a big difference here. I want a reading. I want to know what's going to happen. That's fine. If you feel like you need it, you have to have it. To me, that indicates potential addiction, possibly. And I am not trained to deal with addiction. I'm not trained to deal with addictive behaviors. I don't want to be the person supplying an addiction to someone. I don't want to be a crutch for someone. I felt uncomfortable with that. I referred her to someone else. I said, I'm sorry, I can't do the reading. You want to notice that. Is this something you enjoy doing? You enjoy getting readings. You enjoy getting predictions. You enjoy seeing what's going to happen next. If it worked out, if it didn't work out, that's fine. But if you feel like you have to have it now and you need it, please seek out a licensed mental health professional, because at that point it could potentially be a mental health situation. It may not be. We cannot make that call. It's very general, very educational. I don't know what's going on in my friend's life. I don't know anything, but I just know that I saw that as a potential red flag, and I asked her to go see someone else, because I don't want to be damaging anyone's mental or emotional well-being. What do you have to say on that?
Yeah, I mean, it sounds like a compulsory behavior, and you did the right thing.
Okay.
There's setting boundaries, and that sounded like a good boundary that was set. And I'm proud of you for that.
Thank you. Yeah, I mean, and it's like, that's the thing with professionals in any industry, not just this one, is even if they pay you well, if you feel like the relationship is not helping and it's potentially causing harm, the ethical thing for any professional, I know I'm speaking broadly for everyone. I don't want to speak for everybody, because not everyone's ethical, but in my opinion, the ethical thing to do is to say, wait a minute, I don't feel this is benefiting you, this relationship, and I'm going to cut it off, or I'm going to back away. I'm going to, and it doesn't mean you can't talk to them. It doesn't mean you can't be friends with them, but it's important to create distance to prevent the harm from happening, potential harm. And that's what I tried to do. And I didn't say, oh, I don't want to give you readings ever again. I just said, I feel like maybe you should talk to someone else. And she had said this twice, this anonymous person had said something similar twice. And the first time, and I didn't give her readings either time on this, but the first time I said, why don't we just talk about it as friends? Talk about the situation. I'm not going to charge you. I'm not going to do reading. I'm not going to predict anything. I just want to talk about it with you. And she didn't talk to me about it. And then the second time I referred her to someone else. I said, I can't do this reading. You can ask this person who does readings, but I just can't right now. And she didn't go to the other person. I mean, and that's on her. It's none of my business. But if it was, it just, as an ethical boundary, if you feel like a situation is causing harm, even if they're paying you, it's important to set that boundary. And you mentioned earlier with the therapy, you can't do therapy on your friend.
Nope.
Because it's not ethical.
Yeah, you're right.
And it's the same thing. Yeah.
I mean, that's the whole thing. I mean, I cannot interact with my clients out in town if I see them. I have to effectively, beyond just acknowledging their existence. Oh, hey, hi, how are you doing, that person?
Can you do that?
That's about it.
Okay.
That's about, I make the active avoidance. If I see them, I'll try to, meander. But if they come up and approach me, obviously I'm not going to be rude to them.
Right.
But I don't discuss anything. Obviously everything has to be done in a specific setting, in a therapeutic setting. And just beyond that, yeah, nice to see you, have a good day. And that's it. I have to limit it to that. No different than if you saw your doctor out in town.
Right.
It's the same exact thing. So it's all about that maintaining and confidentiality. I cannot maintain confidentiality in a grocery store or something like that, or whatever. I cannot go and sit down. I can't even accept gifts. They could say, "Oh, it's Christmas." It's like, well, I understand it's a holiday of of significance to you, but I cannot accept a gift because that breaches ethical guidelines.
Yeah, it's very important for, I believe, in my opinion, every industry professional across the board. We need to have these ethical boundaries as professional people. And if you feel like someone is breaching that, even if it's a well-paying client, it's very important to set that boundary. Say, I'm sorry, I can't do that service.
Yep.
It doesn't matter how many people they referred you to. It doesn't matter how much tips they gave you.
Yep.
It's like if you feel like it's harming the person or it's crossing that line of what you can and cannot provide, very important to set that boundary. So, okay, so that would be how to contact. So we are running a little short on time. So we are going to move on to the last section of our discussion with the question of discuss the relationship between spirituality and mental health care. How can they mutually benefit each other? So up until this point, we've talked a lot about mental health care and a lot about the boundaries and how it's different from spiritual things. Now we're going to talk about how they can mutually benefit each other. They may be very different, but there are some mutual benefits to a holistic perspective on this interesting subject. So what are your thoughts about this? Respect.
You need to respect that. And, that unconditional positive regard as, someone who's a practitioner, that I'm going to have to respect that you have your beliefs, whether, or not, I may or may not disagree with them. I have to respect you because that may be a part of who you intrinsically are. And so I may not share those beliefs, but they are important to you. Therefore, I need to be able to respect that. One, I'm not going to tread on your turf. That is yours. And I have to respect that. And so I'm not going to give you advice that is beyond my scope of practice, which your scope of practice is spirituality. I am not going to go tread on that. And I have to respect that.
Yeah.
So that is extremely important, to you as the person, but also on a professional level as well.
I completely agree. And same with you. Like, yes, my scope of practice is spirituality. I don't like saying it like that because it sounds medical. And I'm not. I mean, yes, I have a phlebotomy license. I could technically say I'm, but that's not what I'm working at right now. I just put that out there because, hey, I'm not oblivious to things. And I believe in science. But the point was, seriously, is that as a spiritual practitioner, I do not work in mental health. I am not working in healthcare in this as a tarot reader. It's not even so. It is important for me to respect that boundary as well and say, wow, you know, like with my friend who said I need a tarot reading. It's an emergency. To me, as a spiritual practitioner, I was saying, you know, wow, I feel like that is outside my scope of practice. I can't deal with emergencies. I can't deal with crisis situations. I'm definitely not dealing with addiction situations. So I respectfully said, I'm sorry, I can't help with that. Like you were saying, respecting the medical profession, respecting the mental health profession, acknowledging that, wow, I'm not equipped to deal with this. This is not my profession. Yes, I can give you a tarot reading, but if it's causing a mental health problem, I have to stop and say, wow, that's your turf. That's your business. You know, go see Dan. I should tell her to go see Dan.
Can't do that, but for legal reasons.
Are you sure? Because like
I'd have to be referred to, and I'm not a specialist in that kind of thing.
Okay.
Or at least I don't assume.
I
don't know enough about this person that you speak about, and you know, things have to be referred. This is, you know, it's
like
healthcare.
from a doctor.
Yeah, it's healthcare. So.
I couldn't have her like call your agency and ask to see.
No.
Okay.
Yeah.
I don't know how it works. You see, and that's exactly the point of this: is that as a spiritual person, I don't know how this works.
Yeah.
So I can't speak about it.
And there may be also conflict of interest because I know you,
right.
You know them. Therefore, there is a little triangle there.
Yeah.
So conflict of interest. So, but you know, it's just like, for instance, if I suddenly started as, let's say, you know, you sat down with me and I started giving you spiritual advice as someone who's supposed to have evidence-based care.
Yeah.
Wouldn't that be a very big red flag?
Yes. Yeah, and we're gonna get into the red flags in this section actually. Yes, exactly. Big red flag. If you're, you know, paying a mental health professional, it's evidence-based. They have strict guidelines. I don't know all of them because I'm not in that industry. but the point is that, you know, if they start sharing their religious beliefs, they start talking about God, how you have to pray, how you have to meditate, all of that. That's a big red flag. If they're a mental health professional who's licensed, not in a religious sense, because there are, I do want to,
yes, there
are religious therapists and counselors.
Yes.
That's a different thing, and that's not what we're talking about in this session. If you are seeking out someone like that, that's a whole different thing.
Yeah, that is an entirely different thing.
And that's not what we're referring to. But your therapist, your counselor, your mental health professional should not be pushing their beliefs or viewpoints on you, right?
Yeah.
Especially if it's not evidence-based.
And there's also other things, you know. For instance, if let's say someone shows personal interest in you, there is, you know, it is not uncommon for people to find common ground. But if your care provider asks you out on a personal outing, dinner or something else,
or a date or something.
Or yeah, let's use the word date.
Yeah, we can use the word date.
Yeah, that's
not a bad word.
No, it's I always have to tread so carefully in how I say things. But yeah, if they asked you out on that kind of thing, that is a huge red flag. That's a huge red flag.
And I want to say sometimes this does happen. I went to college with a lady who was a professional financial advisor, licensed financial, and she married her client.
Yeah.
And she quit her job. And she went to a whole new industry. And that was the right course of action.
Well, there's also, it's like, hey, this person I met, it hit off well. I would have to, though, say, okay, if you wanted to see me in a personal life, I could no longer ever see you as a client. Ever,
right.
You know, for that. Because that takes it to a different thing. I cannot be a medical professional or mental health professional. I cannot help you in that kind of way, you know, abiding by HIPAA for ethical reasons, and also be a whatever I am in the outside circles to you. So it's one or the other, but it can never be both.
Right, very true. In fact, the next question is, what are some red flags to look out for in a mental health professional, a life coach, or a spiritual advisor? Discuss the ethics and boundaries of each profession. If we've done that very well.
If they're asking you, you know, inappropriate favors, if they're wanting
that's a big red flag.
If they're wanting to go into your personal, with all three of these.
All three of them,
If they are, you know, if they're asking you for financial information, if they're asking you for sexual favors, if they are asking you for personal favors. Those are things that in all three categories that you should say, oh, wait a minute, I don't know if this person has my genuine best interest in mind.
Right.
Especially if they're coming at me, if I'm paying for a service.
Yeah. and it can be flipped sometimes. Like, I know sometimes the client is the one who starts having feelings.
I have that,
they give you tips
a few times, and I've had to be like, whoa.
Yeah, I know, and that's a huge red flag. In all three of these, if your life coach, your psychic, your clergy person, your spiritual advisor, your mental health professional, your medical doctor, none of them should be considered as like close friends or even friends because they're professionals that you're hiring for a service. It's different if your friend gives you a tarot reading, your friend gives you some advice, but that's not a professional setting. That's a big difference. That's not a professional setting. That's not a client advisor relationship.
There's no legal guidelines. There's
right.
no HIPAA involved.
And that's more informal. But that's different than your client is asking you to go to lunch with them. Or, your client is asking to visit you. Or you invite your client to your house. All of that is a red flag. If your life coach starts, asking you or suggesting things like maybe you should dump your boyfriend. You could do so much better. I'm single. Right?
Oh yeah, that's
a big red flag. Okay.
Wow.
It happens though. I just want to put that out there. It happens, and it can happen gradually. And you want to look for that up front. Yes, it might be normal for the life coach to ask about your relationship because they're coaching your relationship. But if they're suggesting that they be involved in it, that is a big red flag. That is a red flag of unethical behavior because they are professional. They are not the new boyfriend, girlfriend. They are not the best friend. They're not the friend. They're a professional service advisor. And if you do see people, including mental health professionals, doing these things, you want to take a step back, analyze it, maybe ask a third person who's not involved what they think.
There's called second opinion. But there's also reporting.
Reporting.
Report it. If someone misbehaves in that kind of way, report that.
Definitely report it, especially if they're licensed. They could be in a lot of trouble. But step back, ask for a second opinion. Ask your best friend, do you think this is flirting? My therapist said this thing, and it just kind of felt off to me. Do you think they're flirting with me? If the friend says, oh yeah, that's a red flag, then okay, I better do something about it. Sometimes it may not be a red flag, but oftentimes it is. If you feel uncomfortable with it,
if you smell smoke,
you should probably do something about it. Now, there are situations where someone might be uncomfortable with the advice because it's outside their comfort zone, but you want to look at that with a grain of salt and say, okay, is this outside my comfort zone because it's helping me grow, or is it because the person is making me uncomfortable? Is it the advice that made you uncomfortable, or is it the person themselves?
Also, there are certain caveats where you're going to certain professionals for certain things. Let's say, this is not me being inappropriate, but let's say you're in a relationship with someone and you need to go see a sex therapist, a licensed one, not colloquial, an actual licensed sex therapist, right? They're going to give you advice based off of what their specialty is. So you have to go into that knowing what you're going into.
Right. But also the same thing, like I mentioned earlier, there's a big difference between giving advice on the area and trying to insert themselves into the situation.
Yes.
That's
extremely important.
Big, very important. They may be giving you advice on, how to handle something with your partner.
Yeah.
But the moment they try to insert themselves into it, that is a big breach of ethics, a big breach of privacy, big red flag. And the two big things you can do if you feel uncomfortable with any of these professionals. The first thing, distance yourself, fire them, no longer see them, find someone else. The second thing is reporting, especially if they're licensed. Even if they're like a psychic on Mysticsense, if you feel uncomfortable about something a psychic said, and it rubbed you the wrong way, and you feel like they're trying to get involved or something, report it to Mysticsense. Report it to the website. Say, okay, I feel like this psychic was acting inappropriate towards me. And it doesn't have to be sexual. It can be other ways they're acting inappropriate. Maybe they're asking too many questions about your location. That could be a big red flag as well. It's none of their business where you live, But, report it. Distance yourself. Report. And hopefully that will resolve the problem. You know, there's always other professionals you can see. Anything else to add?
No, that sums it up.
Okay, wonderful. So our last question tonight before we wrap up is, what are some of the dangers of blurring the lines between spirituality and mental health care? There's a lot.
Yeah,
and we want to be careful in time because
here's Pandora's box.
Oh,
shall we open it?
Well, we are really close
I know,
on time,
right?
so we have to be careful.
Mental health,
yes.
So I could be pretty blunt and pretty concise on this. Mental health care is health care. So that means it's going to be based upon evidence, it's going to be based upon science, it's going to be based upon reproducible results. So there is going to be written out criteria. I could go look it up and I could say, okay, based upon the signs and presentation that this client has, they meet this criteria based upon this evidence that I have, so therefore I can make a sound judgment call on this. When it comes down to something like spirituality, that's going to be based solely upon interpretation of how that person wants to look at it, versus what the evidence clearly states upon what the diagnostic criteria states.
Okay, I can talk more on the spirituality because I know it's not your area.
No, it is not.
But it's good to have, you know, that's why we're doing this today, because we're getting a mental health view from a mental health professional, and that's very important. So what I'm hearing you say is that there's always a paper trail.
There's always going to be a paper.
That's
if it's not in writing, it didn't happen. There's going to always be. Anytime you see anyone in like healthcare or mental health, there's going to be a lot of written notes. There's going to be a lot of paper trail. There's going to be a lot of progress notes. There's going to be a huge thing on it. It's not going to just be like, oh, you saw that person and off they go. No, there's going to be about another hour or two of written stuff afterwards that's going to be in there, for both insurance provider, but also for, that way the mental health professional could go back and look and also track progress.
And liability is a big one.
Yeah,
liability is a huge one.
There's all sorts of stuff. So there's going to be a paper track record for a whole bunch of different reasons. I don't know if a spiritual advisor does that, but I know in mental health care that is extremely, and also healthcare in general, that is extremely important. And those mental health records also typically go into another healthcare record as well, especially if it's psychiatric.
Yeah. That's very important. The evidence base, the scientific backing, the fact that there's a paper trail, the why behind the reason is very, very important. And now, again, spirituality does not always have these things. In fact, a lot of times there isn't. That doesn't mean it's good or bad. It just simply means it's not the same thing. It's very important to distinguish. Mental health has a paper trail. Mental health has documents backing it up, has licenses, it has processes. Spirituality is not always that way. And that's why, again, it's so important to keep the two separate. And they can work hand in hand, because having a good mental health relationship with yourself, going to therapy, going to a psychiatrist or a counselor, a therapist, whoever it is, your mental health professional, can really help you remain in an emotionally and spiritually balanced state. That sometimes is hard to achieve otherwise, because you need that health care. Again, you can't operate in an unhealthy place, and that's for them to decide, not for us. So us as spiritual people, and I somewhat can speak for clergy as well, because I am an ordained minister with multiple denominations. So I feel comfortable talking about that as well, because it does relate a little bit. It's similar. And I want to say life coach is I want to say it's a little more informal. Yes, there's professional life coaches, but for this, I'm going to focus more on the spiritual aspect. Is a good ethical spiritual practitioner will be upfront about their boundaries and will encourage you to get the help that you need, even if it's not with them. That's very important. And where the lines can get blurred is things like faith healing. And I know that's kind of a sensitive topic because of different religious beliefs and religious systems and things. And I've actually been exposed to both ends of this. Is faith healing is not inherently a bad thing if you're already getting the medical and mental health care that you need from a licensed professional. It can aid, it can provide the spiritual or emotional assistance to enhance perhaps I don't want to say that. I don't think I could say that. Not enhance. That's the wrong word.
If it makes you feel better.
What?
If it's making you feel
right,
better.
if it makes you feel better about the treatments that the medical person's giving you. Like, let's say you have a condition. I don't want to say.
It's social support. Let's look at it that way.
So let's say if there's a condition that you have and you see a licensed medical doctor and you're being treated for it, going to a faith healer after that, in addition to the medical treatment that your licensed doctor is giving you, may possibly provide some sense of emotional or spiritual support. Possibly.
Social support, definitely.
And social. Especially when you're able to connect with like-minded people who share your beliefs and they share your ideas, your spiritual practices, and you practice them together. It can help you feel a sense of community, feel a sense of trust that people are there helping you, that spirit is there helping you and guiding you. But it needs to be in tandem with the licensed medical support because it is definitely not a substitute. And blurring those lines when if people are doing that, whether it's Reiki or crystal healing or faith healing or prayer or going to a clergy member for any form of religious or spiritual healing, it is important that they are also getting the scientific medical licensed healing or treatment in addition to that. And I personally feel as a professional that it is unethical to provide spiritual assistance to people that are refusing to take care of the physical problems. That is my personal opinion and my personal ethics. For example, I am trained in Reiki. I wouldn't want to give a Reiki attunement to someone who I know is dealing with a physical disability and refusing to go to the doctor, because I personally feel that's unethical. I would say if you go to the doctor and you're on treatments medically by a licensed professional, I will do the Reiki to support you because it makes you feel better. It's in tandem with everything else you can do, but it's not a replacement for that medical aspect because it's not the same thing. And I feel like, when these lines are blurred, because not all healing is healing. That word we have to use that word very carefully, but there are so many levels to it. There's the emotional aspect, the spiritual aspect, the physical aspect, the psychological aspect. And when we're talking about this topic, it's vital to incorporate a holistic view of all of those together. And it is not complete without the physical component that the licensed medical professional would offer. So just kind of keep that in mind. Is yes, doing things like faith healing, doing things like Reiki, it's not going to hurt if you're doing it in addition to and not in place of the treatments from the licensed professional that you need. That's kind of what I want to say on that. It's a little bit of a touchy topic. Do you have anything to say on that?
Just make sure you make that distinction, as you said.
Yeah.
Healthcare is healthcare, and what you do is what you do.
Right.
And it's important not to blur the lines.
It's very important not to blur the lines because, we have to realize, again, we are holistic people. We have physical needs. We have spiritual needs. We have emotional needs. We have other needs. And it's important to recognize there's a professional for every need that you have, but there are different professionals in different industries. One person isn't going to fix everything, but they can help fix the part that they're trained to fix.
Just like you don't go to a certified financial advisor for spiritual needs, right?
Right. Yeah, that would be kind of funny. Unless they're a numerologist. Because numerology is math.
Oh, no.
Numerology is math, your life number, your...
On that note, I'm...
Yeah, no, but don't go to your numerologist for your financial needs either, because they're not licensed to help with that. Right? They can tell you what your life path says about your personality and your relationship, but they can't tell you what it says about your pocketbook.
Yeah.
Maybe.
Don't get advice in stocks or cryptocurrency from a numerologist.
Oh my gosh, I have $444 in my bank account. Does that mean I'm financially secure because it's a 4?
Yeah. Makes sense.
Maybe
to
not.
Me,
I don't know.
I'm totally speaking on something I'm not qualified to
No,
talk about now.
that's kind of funny though. Like no, so the point is that there's a professional for everything. See the right professional for you, and if you're in doubt, like I mentioned earlier, if you don't know who to go to, start with the licensed professional. Start with the mental health, and then go see everyone else. If
it doesn't hurt to get a referral.
Yeah, or get everyone's opinion. Just get an opinion from everyone. If the spiritual advice you're getting, because you think it's a spiritual problem, if that doesn't work for you, maybe see, the life coach, because maybe it's just the life planning problem. If that's not working, it's really bothering you, go see the mental health professional. If it's causing you physical distress, maybe see your medical doctor. But get an opinion from everyone, see what works best for your situation, but make sure that you're putting all the puzzle pieces together, because when you miss a piece or you omit a piece of the situation, of the holistic view of your whole person, that is when things can become problematic. Whether that's the mental health, the medical, the spiritual, the emotional, whatever the case is, you want to look at the big picture. I think that's all I have to say on that. Do you have anything to add before we wrap up tonight?
Invest in Dogecoin? No, I'm just kidding.
You can't say that.
I know, it would be funny.
Don't take that as financial advice.
That was not.
Okay. Anything else?
No, I was being funny on that.
Okay.
One, but you covered it very well.
Oh,
and
thank
that was
you.
very well said.
Thank you so much. I hope I didn't cross any boundaries. 'Cause we have to be so careful because of rules with words. Like in the country we're in, there are certain words we have to be careful how we say them. So
yes.
If our wording sounded weird, we apologize, but we're legally obligated to say it like that.
Same here. That's why I have to be very intentionally vague.
I hope I didn't cross any boundaries.
No,
because I said the word heal, and I'm a little uncomfortable with that word.
It is a very dicey word to
I know,
say.
but I hope I said it appropriately.
Heal, diagnose. Yeah, those are always very skipping around words that you always have to be so careful with, and I have to do it too. I have to be very careful and have scope of practice.
Yes,
that's the word that I have to use. It's like, is this in my scope of practice? Yes or no?
A lot of times it's not for every industry too.
Yes,
because every industry is so unique.
Yeah,
that's why you have to go to every professional for every problem. Because one person can't fix it all. We're just not trained to fix it all.
Yeah, that's very true.
Yeah. So I hope that answered everyone's questions. I know this was a highly anticipated episode by many Mysticsense psychic advisors who were excited to watch this. Because it's not often that as psychic advisors we get to talk to a mental health professional. So it's exciting for us. So I hope that you enjoyed learning about mental health and its connections with spirituality and how it's not connected with spirituality most of all. And thank you for joining us, Dan.
Absolutely, yeah.
We really appreciate it. Do you have anything else you'd like the viewers to know before we end our session tonight?
Mental health is not weakness. If you feel like it, it's self-care. This don't attach a stigma to it. It is something that you have to look at as in you are treating yourself. That's really basically it. Don't look at it as if it's a negative. You're taking care of yourself and you're actually getting that care, and it's a good thing. And you're never too good for it. It's just something that you should always say, like, hey, if I'm feeling down, it's okay to talk to someone. That's basically it.
Thank you. And make sure to head over to, I believe it's our FAQ section. I may be mistaken on that on the platform. Hopefully it will be linked in the description of this video where you can find a list of hotlines for crisis, mental health crisis hotlines. So make sure to check out the link in the description of the video. We will have hopefully a list of mental health crisis lines that are free to call. And
that's
free to connect, because we have that on our website too.
That is great,
because we've had a lot of clients struggling with mental health, and
that's fantastic.
That's the only way we can help with it.
Yeah, no, good on you guys.
It's the only way is to say go see these people.
Yeah.
But yeah, so definitely check that out, and that can be your first step to get the help that you need, because they are trained to help you with finding out what to do next. Thank you for watching, everybody. It has been great. My name is Phoenix, and this is Dan. And we hope to see you in the next episode. Bye.
Take care, everyone.